Everyone, and thank you for joining this breakout session of round 3 of our breakout sessions for this afternoon for our Empowerment and Policy Conference for the Urban League. As you all know, if you're in this breakout room, the title of this panel is Ask the Doctor. I am Sharonda Williams. I'm excited to be moderating this session that will give you, the audience, a chance to hear directly from our speakers, who are 2 incredible doctors who have a range of experience in the health topics that we will discuss today. First, we have Dr. Christie Anderson, who's the Assistant Professor of Research for the Department of Medicine at the LSU Health Sciences Center at the Lafayette campus. And we also have Dr. Hebert, who is a practicing pediatrician and the Chief Medical Editor for NBC, WDSU-TV, and BNC. I will start by asking them a few questions to get us going, but then we'll ask for questions from you. If you can put your questions in the chat box, we'll save time to address them as they pop up in the chat box. So before we get started and before we jump into a bunch of serious questions, let's get a chance to get to know the 2 doctors on our panel. So can each of you share a little bit about your background and what you do? I'll start with Dr. Anderson.
Hi, Sharonda. Thank you so much for inviting me to sit on this panel. I'm Christie Anderson. I actually am a social scientist. I'm not a physician, so I just want to make that clear. What I do and what I love to do is study behaviors. I study people, I study behaviors, and I study influencing factors that affect outcomes, particularly in the medical education and kind of health disparities arenas. I'm the Assistant Professor of Research for the Department of Medicine at LSU School of Medicine, but I'm here in Lafayette, Louisiana at the public hospital. I also serve as the Director of Medical Education, where I work with undergraduate medical students and graduate residents and fellows, and also teaching faculty. And then I'm also head of a grant program on disparities for the School of Medicine, which we look for innovative ways for our physician, faculty, our residents, our medical students, our staff to look at ways to bring awareness to or reduce healthcare disparities within our training hospitals. So that's a little bit of what I do. I serve also in the DEI officer kind of space and realm and the campus ombudsman. So it is so nice to be here again. So thank you.
Thank you. So Dr. Hebert.
Yes, I am really happy to be here as well. Hi, Dr. Anderson. How are you?
Hey, I'm good.
And Sharonda, it's great to see you as well. I'm faculty at LSU as well, and faculty at Tulane. I do practice medicine. I'm internal medicine and pediatrics, and do a little ER, and did that for many, many years. And now I'm starting to focus more on administration, and I do a lot of media. So I'm the Chief Medical Editor for Black News Channel for the country. We have about 65 million viewers now, and I've been the principal investigator on over 60 FDA regulated clinical trials, including all 3 of the COVID-19 vaccines and both of the COVID-19 monoclonal antibodies. So, you know, as we have looked at all of these things, we know that we have a long way to go, and I'm anxious to get started and get some of your questions.
Okay, great. So your references to COVID gets us right to where we want to start. We can't have a panel about Ask the Doctor without talking about the one thing that has occupied all of our time and energy and our minds for the last year and a half. But I want to take an opportunity for you guys to address sort of where we are with the COVID virus at this point in time. I mean, now we have mask mandates being lifted, airports lifting mask mandates, but at the same time, we have China that say that they're experiencing another surge, and our beloved Barack Obama, who just said that he was diagnosed with the virus over the past week. So if you guys could just give us a little bit about where you think we are in relation to the pandemic, since people now tend to think it's over, like, where are we? I'll start with Dr. Hebert.
Well, in the immortal words of Aaron Hall and Teddy Riley from Guy, it ain't over. Okay. You know, the reality is right now, we have seen each time in the United States that we've tried to say that it was over. We know that we've been mistaken. So for example, in July, when we decided to lift the mask mandate, indoor mask mandate for people that were vaccinated, here comes Delta. We decided to open up the travel right around Thanksgiving, and here comes Omicron. So I think we all have this issue of why are we making these types of decisions, right? We have public health being a four-legged stool. Those legs really shouldn't be equal, but they kind of are. And one of the legs is science. The other leg is public outcry. The other leg is politics, and the other leg is money. They shouldn't be equal because science should have the biggest leg, but it does not. And so we have to have these other things and take these other things into consideration. So basically where we are is that the economic drivers pushing things to reopen. There are 5 phases to a pandemic. The first phase is the pandemic itself, the world pandemic, where everything is disrupted. The second phase, which people think that we are in, but we are not necessarily sure, is the deceleration phase, where it becomes theoretically endemic. But the problem is that we know right now China is shut down. I don't mean China's like, oh, we're having a little outbreak. No, China is totally shut down. So if you're thinking you're about to get a new iPhone chip in the next 8 months, it ain't gonna happen. So these things are an issue. The Omicron BA2 subvariant, which is was started in Denmark. I was actually in Denmark a couple of weeks ago looking at this. It is spread throughout the world, and it is here. And will people, and this is where National Urban League situation comes into play here, and the four-legged stool, will it affect the United States the way it's affecting other places? It's hard to say, but what won't happen is that the United States will not shut down. And the reason why is because there's too many economic drivers and too many political drivers right now to go back. So what we're looking at, which is a real problem, is the collateral damage. And what has the United States expected and accepted as its collateral damage? The collateral damage is people are going to die. Okay, it's not going to be on the news a lot anymore, but it's going to be something that is going to pop up every now and then. And the people that are going to die are the same people that are always collateral damage, who died at the beginning. Poor people, Black people, any person of color, people that are have poor housing, people that have social determinants of health that they're not appropriate, and the people that are having pre-existing illnesses and immunocompromised states. I do want to read one more thing, then I'll give it to the other doctor here. I always tell people these numbers because it's important. In the world, there are 462,851,000 coronavirus cases that we know of, and 6,777,000 deaths. In the United States, we had 81,258,000 coronavirus cases and 993,000 deaths. And that's as of right now to this minute. And those numbers of deaths are going to go up, but they're going to look just like the people that got afflicted at the very beginning.
Yeah. Thank you for that. And just to follow up on a lot of what Dr. Hebert said, Dr. Anderson, he spoke a lot about not necessarily the strict science and how we're dealing with the virus, but also all of these other issues that are more political, socio-political drivers about how we're responding. And I know we've had a lot of discussion in the community about CDC guidelines and why they've been what they are and how they've changed over time. So I want to get you to comment on that piece of it from the equity perspective, since that is your expertise.
Yeah, and it's funny because Dr. Hebert and I didn't get to connect before, but as he started off by saying about politics, I was thinking like that was my immediate kind of response, was like the politics of this is driving so much of kind of where I guess the government is stating, the mask mandate being lifted. The CDC, of course, came up with social distancing, mask mandates, and all of their guidelines. And being in a hospital, I work in the hospital, during the height of our surges when COVID first came out, and then our second and third. I'm so confused on which surge we're about to start, but it's not a big deal for me to have a mask on, and it's not a big deal for me to be like it's not. And I think that it has become so political, and that has created such a divide between people. I kind of I probably should say also too, like I really speak very truthfully sometimes, so I have to be careful that I'm making sure I guard my words. But I always think that something as necessary as a mask, as social distancing, as being cautious, as getting vaccinated, when we've had some of these things in our healthcare, workforce, many times, it begs to question, what are we really fighting and what are we really trying to resist? And so when you look at the human spirit, you think that these things, when you're forcing people or you're mandating people, it's that resistance that I think people need to take note of and understand that, we are in humanity, we have to take care of each other. And we have to think about those things in how we respond to taking care of each other. And Dr. Hebert, discussed the targets, the African-American people, those that have faces that are Black and brown, that are being, hard hit, by this virus. But they are the same people that I see every day turning over those rooms in the hospital and cleaning behind those that have been infected by the disease. They are feeding them in the cafeteria lines. All of those individuals put their lives at risk every day. And so we have to take that into consideration. And I sometimes feel that, it's just now, it's like, oh, well, I had it, it's okay, So it's a really strange place to be in, especially being in the hospital, hearing some of the comments, in the hall. So I'm not sure if that answered your question, but that's just kind of like the social science person in me, just looking at it from a political, and a humanities perspective.
Okay, that did answer the question. So I do have another question though about sort of the more scientific spin on it. I think Dr. Hebert mentioned a moment ago that now we have a subvariant of Omicron. There's this, I've heard a lot of chatter about the potential variant that might come our way that is as lethal as Delta, but as transmissible as Omicron, and what that could look like. What do we know about future variants and vaccines, considering the fact that now we're hearing Pfizer wants to do another booster and things like that? So if you could comment on that a little bit.
Sure. So when we look at these concepts of variants and mutations, let's kind of delve a little bit into the science of this, right? So a virus's job is to kill you, okay? Its job is to survive and to kill you. So, if you think about it as a layperson at your house, and every night you try to lock all your doors and lock all your windows, and you got a lot of doors and windows. And so you have to look at everything. Well, the burglar only has to look for the door or window that you left open. And that's the virus. The virus is the burglar. So you have to try to look at everything. The virus is looking for what you missed, right? So that means you didn't wash your hands. You did wipe your eye. You didn't take your shoes off before you went in the house. You are overweight. You are diabetic. You do have hypertension, right? So these are the types of things. So what happens is the virus will say, okay, I need to mutate, but I can only mutate when I'm infected. And this is where the global issue comes, because if we don't vaccinate the world, the virus can actually survive a lot better and mutate a lot better because it's infecting people at a higher rate. So the world is really only 15 to 20% vaccinated. So when you have a variant, okay, Omicron was a variant, okay, or a mutation rather, then you have a variant. So that was, they have BA1, BA2, and BA3 of Omicron. BA1, BA3, not that big of a deal. BA2 kind of was a sweet spot and then kind of took over and started having an issue. But there's a lot of Greek alphabet left. And we know, as with the hurricanes, even if we get to Omega, we can start over with Alpha. So there's no end in sight when it comes to the amount of variations that we can have. The vaccines, okay, and this has been a huge issue, man. I fight this fight every day, and it's cost me a lot of time. It's cost me a lot of hair. See, it's when you drive across a bridge, you trust, and you've always trusted, that the engineers that engineered that bridge will get you across. When you get on an airplane, right, you have engineered the people that have flown that plane. You have considered the concepts of that you are in a, you know, a multi-ton metal box hurtling through the air, but you trust that the person that's done that, who's, you know, got their hours in it, can take care of you. But we did that all the way up through Ebola and Zika and all the rest of the H1N1 for many smallpox, everything. We did all that, okay, until COVID. We even did it about 8 years ago, and I was a principal investigator on this vaccine as well, meningococcal type B, where a lot of people that are dealing with students in college and in medical school, everybody's got to get meningitis type B vaccine. But we made that vaccine from being in a pipette in a lab to being in arms in Princeton University and available for anybody in the United States in about 9 months. Nobody said a word, because this is what we do. This is nothing new. And the reason why nobody said anything is because everybody was about their business, trusting that we do what we do. But what happened with COVID is that everybody was at home. And they're like, let me be a jackleg scientist and figure out, what does the FDA do? How do y'all make these vaccines of which you speak? And then they want to know. And it's a very complex thing. Not very easy to do, but it's also got a very specific way that you need to handle it. And so, you know, we never really had anti-vaxxers or people that didn't want to take vaccines before the advent of, you know, widely available internet, because where were you going to go to get anti-vaccine information? Stop your job and then go to the library and look it up? Absolutely not. So people didn't have this issue, but now you had a whole bunch of time and a whole bunch of stuff where you could just look at it anytime you wanted. And then you said, well, I think I'll try to figure this out. And this is where our problems have started. Vaccines are never made so that nobody will get a disease. Vaccines are like seatbelts. Vaccines are made so that we can give you the best chance when you are encountering a disease state or something that can harm you, to not be as harmed as you could possibly be, because you know eventually you are going to be encountered with that. Okay, so same thing with the car accident, same thing with the vaccine. Problem is, I've unbuckled, as an emergency room doctor, I've unbuckled a lot of people from, you know, car accidents that are dead in the car while they were wearing their seatbelts, because nothing is 100%, neither is a vaccine. But what we do know is that if the world is not vaccinated, it allows the virus to replicate a lot more readily and a lot more widespread, which means what I am predicting, and what, getting back to your question where you have the thing that something is deadly and just as infective, we're about to go into spring. And then the virus doesn't replicate very well in spring, neither does it in summer. But it is still replicating around the world where there's not a lot of vaccination. When that happens, then it has a huge chance of taking a lot of time and mutating into something that's much, much worse. Will it be a plague that's going to, you know, kill the world? No, because most people are going to be, we're going to get closer to herd immunity, and people are going to have natural immunity. But the problem is that the people that don't are the people that are less vaccinated and the people that have the most pre-existing illnesses, which brings us back to our social issues, the people that are disenfranchised in every place in the United States and across the world. So will that happen? You will see a surge in the spring/summer, late spring/summer. And one more thing I have to say, it doesn't matter how rare something is, if it happens to you, it's 100%. And no matter what we feel about how it's just a cold, we don't know the long-term effects of COVID-19, because we know it's a neurologic issue as well as a cardiac issue. So you just don't want it, no matter how mild the initial symptoms are.
And if I could just piggyback on this, you know, I keep saying, and, you know, everybody thinks in the hospital here, like, you just need to get it. Like, you know, you just need to get it. My whole thing is, I don't want it. I don't want it. I don't want it. You know, it's not like, you know, I'm up against, you know, somebody foreign, like, I don't want it. And I think, as, you know, and I also don't want to infect my parents who are in their 80s. I don't want to bring it to my kids. You know, I don't want it. And so I think, you know, Dr. Hebert is of course so on point with the ways in which people have just taken it upon themselves to be these Google MDs, is what I call them, where they looking up stuff and just trying to say, like, you know, but I think all the time, I mean, in the hospital here, you present with, like, you know, your big toe hurts. there is somebody writing something that says, oh, okay, take this. You have no idea what it is, but guess what you're going to do? Go to Walgreens, fill it, and take it. But this vaccine has just created such a resistance from people. And it's also, you know, sadly to say, I'm just going to say this, and this is just me, but it has become, it's their disease. It's our disease, the Black people's disease. Like they're getting it, that, you know, and so it just is, it's very hard sometimes to understand, you know, the mindset of individuals. But anyway.
Yeah, can I throw some out there, Sharon,
Definitely.
too? It's, you know, and this is going to sound harsh, but we have a huge, this is National Urban League. So we have to address things in a way that I have to address them just straight up. And the reality is that we had a lot of African-American folks that were, you know, that have never questioned medicine at all, ever. You know, to say, well, I'm not getting the vaccine. I even have like 14-year-old, 15-year-old boys. Well, I want to get this vaccine, that type of thing. And what I had to say to them, even to their parents, is when rich white people do things, okay, you probably should just follow suit. Now, if this vaccine was made for just Black folks because of all the things you want to mention, you can mention Tuskegee experiment, you can mention all these things. I get it, okay? But this vaccine was not made for just Black folks. And historically, what we have to know is that white people, white Americans were actually going to Black areas so they could get the vaccine that Black people would not get in their own area. And so what I will say is, you know, it's when you don't have anything to fall back on as a Black person, right? And people want you to do something, just think about it in the history of the United States. When rich white folks do stuff, you probably should go ahead and do it.
Well, that segues into my next question for you guys, because as you said, I've heard all sorts of things from different people about the Tuskegee experiment and things that go as far as saying, oh, they're implanting something. The government is implanting something in me with the vaccine, even though we all carry a smartphone. What can we do to communicate to people and get the right communications to people about vaccination, the risk of not having the vaccine, and also just how this is going to disproportionately affect people in the Black community and people who have the different kind of pre-existing conditions that sometimes are really more highly concentrated in the Black community. What do we do about communicating that?
You want to take a stab, or you want me to go, Dr. Anderson?
No, yes, you take.
Okay, okay. So, you know, it's funny you would mention this because, you know, it's hard to look at stuff on the internet and be able to discern whether what's true or what's not true, right? And I'll give you an example. About 7 weeks ago, Reuters did a study, did a story that said ivermectin proven to prevent COVID-19, okay, in clinical study. That was the lead, okay? Now, when you read a little bit further into that, the study wasn't done on human beings, okay? The study actually had no peer review, no scientific method involved at all. They ended up having to come back in a couple of days and kind of take that down. But the reality is that this is just not a problem for COVID-19. This is a problem for the permeation of misinformation in the internet. So there is an organization called the truthcheck.org, thetruthcheck.org. And I am the leader of this medically for the United States. And basically what it is, it's from the Center for Health Equity. And basically what it is we're giving you the ability, and there's even a free course you can take, okay, to say, this is what you need to look for when you look at, when anybody gives you any information, you need to look at these few things to be able to say if this is real or not, okay? So in my section with, you know, medicine, if there's a study that comes out, is it peer reviewed? Is it double blinded? Is it placebo controlled? And is it published? Okay. If those things aren't met, you should not believe it. Bottom line. And those are the types of tools we need, because as in our community, what we have to always remember is that we are the thought leaders. Your grandmother is the thought leader in that house. She don't want to hear what I'm gonna go old school, Harry Reasoner has to say. Y'all probably even know who that is. But anyway, Roger Mudd, she don't want to hear all that. That was from her time. She says, what I say goes in this house. So when you just clickbait something and then you're going to spread it, And we can't do that. Same thing with the vaccine. How do we get people to take the vaccine now? Sharonda, I don't know. I truly, truly don't, because we have done everything to make jingles. I have my daughter animated as a cartoon character to try to get people to take the vaccine. We have had, from Fauci to, we have get your Fauci ouchie, which is the vaccine. We've had, you name it, okay? And we cannot break through. And at this point, I don't know that we'll be able to, but the vaccines will be there. Pfizer is coming out with the 4th. We know that, and it's just going to be right now for people that are immunocompromised, which is very important they get. But people say, oh, well, it can't be a good vaccine because you got to give it a bunch of times. 2 months, 4 months, 6 months, 12 months, 15 months, 4 years, 6 years, 11 years, 14 years. That's what children get for the same vaccine. You get your flu shot every year. It's a different shot. So why all this pushback now? It's because, and I'm gonna give you this one too, it's a little scientific here, but it's kind of it's pretty good. We did a study to show people just don't like to get shots. Adults don't like to get shots, and they don't like to know they're gonna feel bad possibly for a couple of days. That's it, because at 6 months of age, children, babies get 5 shots. They're like a pin cushion at 6 months. And then there's a 6-month shot that you get, which is a flu shot. So the study started, hey, Mr. Johnson, would you like to get your child the flu shot today? It would be the 6th shot he's getting today at 6 months of age. Sure, that's very important. The flu shot's very important. Yeah, you should get it. Okay, that's great. Here's when the study started. Oh, Mr. Johnson, okay, your daughter just got the flu shot. Now, we actually have extra flu shots, and we could actually give you the flu shot today as well. Oh, no, I don't want the flu shot. Flu shot don't work. You just gave your 6-month-old daughter a 6th shot for something that doesn't work. Well, no. So you can get the flu from the flu shot. Oh, so you want her to have the flu tonight? Come on, Mr. Johnson. And what we really found is that's when we gave him the handout and the study questionnaire. And basically what he said was, man, I just don't like shots, man. That was it. I just don't like shots, man. And once we kind of get over that concept that people just don't want to feel bad for a couple of days, I think that's where it is. And also, I cannot forget that Donald Trump, and this is an apolitical situation, okay, but that came out. The whole concept of vaccination for COVID came out of Donald Trump's regime, okay? And because of that, there was an inherent distrust of Donald Trump, and that's where I think the initial distrust started, because if we had had someone else in that White House when this started, I do not think that we would have had as much pushback.
Yeah, I agree. And yeah, I just want to tag on, it was interesting as well. And for me, it's just kind of from my kind of lens, when the vaccine came about, I got a call from our CEO that just said, I need some help. Our employees in particular areas that I mentioned earlier in the hospital just don't want to take the vaccine. And she said, I need some help in how to get them to take the vaccine. And I just could not understand that here are the faces of my people that are not willing to just get something that's free. Like we're not asking you to pay for it. And we had it down the hall, and it wasn't that you had to go somewhere else. We weren't trying to put you out of, the day. We just, and what I did was I was just like, if I would have had Dr. Hebert, it would have been a no-brainer. I'm going to stick Dr. Hebert up there and I'm going to say, speak to our people. Like, what are we doing? But what I did do is put together a panel of some of our physicians here, that had faces like them and talked about just the honest truth, and allowed them to ask certain questions that I think were inherently just kind of rubbing them the wrong way. And I sometimes wondered if they even had primary care physicians or if they were comfortable in asking some of these questions, and having them in a room together, asking these questions among their coworkers and being in that comfortable situation. I know a lot of them, the switch flipped. And I I don't know what the whole point of this is, but it just was very shocking to me that, we had to really coerce them into getting something that they were exposing themselves to when, as cafeteria workers or housekeepers or, EVS, all of those things. And I'm thinking, what are we doing? What are we thinking? And then the ivermectin, as Dr. Hebert, that whole game, and that became the whisper game that everybody then started telling, oh, if you take all of this ivermectin, you'll be, it was here in Lafayette, somebody even called into a radio show that, was a healthcare provider. And I was just like, this is out of control. So, from a behavioral perspective, it really was alarming, and also questionable about who's treating our patients. And in a community hospital, a safety net hospital where I sit, I also, question that, like, who is treating our patients, and are they being fair?
Well, I think when we're talking about communication, we can't overlook the role of social media and the fact that we all get our news now from a scroll through Facebook, and we all read headlines as opposed to looking at all the things that Dr. Hebert just said about the validity of things in terms of, are they peer reviewed? Who paid for the study? And all of those different things that make it valid, right? So that's definitely something that we have to think about in terms of how we're getting our information. But we're going to switch gears a little bit. We have somebody in the audience who has an example about how the medical field is responding to patient needs. And we want to invite that person to share her experience, and then we'll have some time to talk about that after. So if you can unmute yourself.
Hi, hello.
Hi.
Can you hear me?
We can hear you.
This is Lorette Neville, and I want to talk about PATOS. PATOS stands for paying attention to other symptoms. And the reason I started PATOS was because my son passed away. He was a very healthy 23-year-old young man. He was a college graduate on December 18th of 2020. Just 4 months later, he passed away. He was home because of COVID. Very excited about graduating. Once he graduated, he had gotten to an internship. Through some of the struggles that he had to go through in college, none of them were medical. When my son came home from the gym, which he did quite often because he used to be a basketball player, so he was an athlete in college and decided to become a journalist, a sports journalist. So all of the things and the habits that my son had, they were very unique, but they were repetitious. I knew his schedule even in college. He's going to be in the gym, so he was very healthy. He was a vegan. He had, had a very structured life. So I want to give you the background on my son so you'll have an idea of why I had to do something. He came home one day from the gym after a workout, which was the routine, and he told me that his stomach was hurting a little bit. I'm not really concerning myself. He's 23 years old. He can handle a stomach ache. He goes in the bathroom, and I could hear him. My husband and I could hear him from our bedroom. After about a minute, I got very concerned. We got up, asked him if he was okay, and he went on to say, my stomach, my stomach. At the time, because we are not medical professionals, we thought maybe, he ate something bad, maybe it's food poisoning, but I know he's coming from the gym, so that doesn't really fly with me. But the entire while, he was complaining about his stomach. He did that for about 30 minutes until we realized maybe this just isn't a regular stomach ache. Maybe we should seek medical attention. So I called 911. When I called 911, the ambulance finally came, but I gave them specific instructions because my son was very tall. And I asked them to make sure, hopefully, if it was available, the drivers that they had or the medical professionals that they had could handle my son properly. When they came in, not only were they unable to get him out of his room, but he was in excruciating pain holding onto his stomach. My husband and I had to get him out. Okay, they get him to the hospital. COVID is happening, so we cannot ride with him. The hospital's only 3 minutes away, so we took him to the nearest emergency room. When we got to the emergency room, I asked if they had given him anything. They said that they had given him some Zofran, which was for what they thought, probably what my husband and I thought was wrong. They asked me if he was allergic to anything. I said, I do not know if he is, because he's never been ill. He's never been hospitalized for anything. So I would use precaution. Just in other words, if you're going to do something with the stomach and there may be an allergic reaction, give him a Benadryl or something that will aid, because I'm not sure if there will be an allergic reaction. They said, no problem. We went to the back of the emergency room. It was very, very quiet. There was only 2 other people in the emergency room. So we were waiting on pretty quickly. They told me just to be safe, after about 15 minutes of checking him out and asking him questions, a lot of moaning and groaning from him, if he started to feel better because of the Zofran. I stood there and I heard my son say, yes, but he was a little groggy. They said not to worry about it because that's a side effect from the medicine. I said, okay, that's fine. The doctor came in the room and said, we're going to give him an abdominal scan just to be sure that there's not anything else going on in there. And after that, we will be released. I said, okay, that's fine. They took him out for the abdominal scan. And I asked, would it be okay if I left? Because I only lived about 3 to 5 minutes away from the hospital. And I wanted to get him some long jogging pants because it was cold outside. And when we got him to the hospital, obviously we weren't worrying about what he had on. He had on some house shorts and an undershirt. When I came back to the hospital, he was not in the room. I asked where he was. They said that he was still getting examined. I said, okay. So about 3 minutes later, he comes back, and about 2 minutes after he's in the room, he's very groggy and he looks worse than he looked when I left. And I said, are you okay, son? Because by now I'm thinking the Zofran should have, be at the midway point where it's kind of wearing off, but you're comfortable. And he's just moaning and groaning. And I'm saying, what is wrong with you? So I asked the nurse, I said, did you give him something else? Because he doesn't look right. And he said, oh, we gave him some morphine. And I said, why did you give him morphine? He said, because he started complaining about his head. So we just wanted to comfort him, but we believe it's probably just a side effect from the medicine. So now I'm getting uncomfortable because my son does not look right. And so I tell the nurse, he says that his head hurts. So what we probably don't want to do is just give him something to close his mouth up so he can stop complaining, but maybe check his head. So he says, no, he's complaining about a headache, probably because that's a side effect of the medicine. But mother, if it makes you feel more comfortable, I will go and get him something for his headache. I said, okay, that would be fine. So now we're on the 3rd medicine. The nurse comes back and says that someone else is going to come because he's about to take off. So we're waiting on the shift change. So he wants to get a little urine from Tristan, but Tristan is not really responsive. He's kind of groggy, but he's really not as responsive as I would have liked him to be. But obviously it's from the morphine. So he says, it's no big deal. If we can't get the urine, we'll just not deal with it because I think everything is fine. This is what the nurse told me. So the nurse left. A few minutes later, I'm gonna say about 10 or 15 minutes, another nurse comes in the room. When she comes in the room, I can look at the expression on her face. She feels she's uncomfortable. So I look at her and I said, why are you looking like that? What's wrong? She said, how long has he been like this? I said, well, they gave him morphine. I said, my son doesn't take baby aspirin. So I guess it's had a full effect on him. I said, so do you want to, she said, no, before I could even get the words out, do you want to check him? She starts to check him, wiggle his toes, things of that nature. And then she says, he's non-responsive. So she calls in a code, which I knew what the code was, which is a non-responsive code because I worked in a hospital years ago. So now I'm freaking out just a little bit as a mother. So she comes in, the doctors come in, and all of a sudden I can see within an instant my son's body starts to turn colors. There's little speckles on him, and I take a picture of the speckles, and I'm screaming and I'm yelling, what is this? What is happening? And so they said, I think he's having an allergic reaction to the medicine to the dye that they gave him to check his abdominal area. And I said, well, was anything going on in the abdominal area? Well, they can't really answer me now because they say they have to give him the EpiPen shot now. If not, he's going to die. So they give him the EpiPen shot, and all of a sudden I could see his pressure go up so high until I just wanted to fall out on the floor because I'm trying to figure out what is happening. He's non-responsive. They got to take him out. They've got to bring him to the next room where they got to do some type of restoration. In other words, my son has now passed, but they're trying to revive him. And I'm trying to ask questions, but I cannot because nobody really knows what has happened. And if they do know, nobody's not telling me anything. So now I'm thinking, okay, they're going to revive him. It's going to be okay. Everything's going to work out. Well, that doesn't happen. About 20 minutes later, a nurse comes out to see me. And I said, what is going on with my son? She said, I cannot talk to you, but the doctor will come and see you. The doctor comes to see me and he says, I just need you to know, Mrs. Neville, this is a serious situation. I said, what is going on with my son? And he said, well, I don't really know, but I think he's hemorrhaging. And I said, hemorrhaging from, and he said, his head. And I said, could that have been the reason he complained about his head a few hours ago? So he said, we've got to get a neurologist to come in because there's nothing we can do until the neurologist gets here. So now we've got to wait on the neurologist to get there, who finally gets there, goes in, does what he has to do. He comes out and he speaks to me and he said, I think I know now why your son was complaining about his head, because he's hemorrhaging, and he's hemorrhaging really bad. Had they called me 2 hours ago, I could have saved him. But right now, I don't think I can save his life. And I said, what are you talking about? I don't understand. I just did not comprehend in that moment. And they say, well, he says, Dr. Wang tells me he's going to do an emergency surgery. He's going to try, he's explaining all this medical terms. He said, I do not have time to explain all of this. You're going to have to sign the consent. I don't know what I'm signing, what I'm reading, because now it's a life or death situation. So I sign it. I start calling my family members to tell them what is happening. They do the surgery. And then he said, before the surgery, let me try to just stop the bleeding, but it's massive bleeding in his head right now. So then he comes back, he says, okay, I've stopped the bleeding, but it's not permanently stopped. He's still bleeding, but not as much. So I have to go in and do a surgery. You're gonna have to just wait and see what happens, but there is a 3% chance that your son is gonna survive. I'm really not comprehending all of this because it's all happening in front of me and I don't understand. I'm just being honest. I don't understand what's happening. So then the doctor was very honest with me and he said, off the record, had they called me when he first started complaining, if this was a mild hemorrhage or something was going on, I probably could have saved his life. And he starts to give me different medical terminologies of what he thinks may have happened. He said, but I cannot be authentic with you because I do not know, because by the time they called me, it was too much blood and it's in the worst spot of his brain. I don't know if I can save him, but because he's only 23 and he's got a clean bill of health, I'm going to try and save him. So now all I can do is just hope that this doctor is going to save my son's life. Well, it didn't happen. They put him in intensive care. They had him on a respirator. They told me they were going to wait until Monday to see if the surgery helped. If not, then that's it. It is over. So while I'm experiencing all of this, I've got tons of questions. I don't understand. This doesn't make any sense. He came in for a stomach ache. What type of sickness could he have had that would have allowed maybe a stomach pain to cause the hemorrhage? The doctor cannot answer my questions. The surgeon who did the surgery was very honest with me, even though the hospital wasn't. And he said, I don't know what to say to you. He literally had tears in his eyes. He said, I don't know what to say because I don't think I know exactly what transpired. The only thing I have been able to do is try to save him based on what I think may have happened. And so now 4 days have passed, and they've given me the option to take my son off the ventilator, which I do not care to do. And then obviously, just to kind of fast forward through the story so I don't have to live through it again, I just prayed about it. I had a specialist who happens to just be a good friend of mine, who's a world-renowned brain surgeon, to take a look at the x-rays. I had some friends that I know in the medical field, and they all came to the same conclusion that there's no brain function. He's brain dead. And so now I don't really have a choice. I've got to plan the opportunity to take him off the ventilator and just watch him go. And so that's what ended up happening. During the time that all of this happened, I am not only a mother, but fortunately I am a leader in my ministry. So now I've got to try to apply all of the things that I minister to other people about in tragic situations, which is a very hard thing to do. But I managed to get through it all, and I still had tons of questions. The surgeon called me the day of the funeral. He sent me a text to let me know that he was very sorry, that he had done all he could, and he wished that they would have called him earlier because he thinks he could have saved his life. Well, obviously he knows that's not going to do me any good, but I did appreciate the fact that he put his heart into it, and I got that part. I got that part, that he did the best that he could do. So once everything had calmed down just a little bit, I prayed about coming up with something, because I knew that they prejudged my son. How did I know that? I'm really not a judgmental person. I think everybody deserves a fair shot. I'm married into a family that have a lot of medical professionals. So I have no issues with medical professionals, lots of respect. But from the way everything went, because I stood there and watched it, somebody dropped the ball somewhere down the line and nobody wanted to take responsibility. And so I decided to bring awareness to hospitals and medical facilities that made them look deeper into a person's symptoms, because sometimes you may think it's one thing and it may be something else. I didn't know at the time if it was because of an insurance. He had insurance, so I didn't think that was it, but I just didn't know. All of insurance are different. Did they require certain things to happen before they could dig any deeper? These are the questions that I had. I was very disturbed. I still am by the situation, but I decided that rather than just ball up in a corner and cry, I would do something about it. I would fight back. And so that's where Patos came from. And it was just pay attention to other symptoms. I am very confident in it. I believe that this nonprofit stands out. I believe that there's not enough awareness to bring attention to individuals that go into the hospital. And then I started to do my homework about this particular hospital, which made me very upset. A good friend of mine had passed away from a minor surgery. And then I don't want to get into all of the depths of it, but I started to hear horror stories about African Americans that went to this hospital, which made me dig even deeper. And so as I began to do my homework and dig deeper, it bothered me because I knew that my son was prejudged. And the reason I say that is because my son was an athlete. All of the athletes had tattoos on their arms. They had what they call a sleeve. So maybe they just looked at him and figured it's no big deal. But I think there's a precaution that has to happen when you're giving medicine to different people, because they're all going to react different. So I knew, yes,
and
absolutely.
Your story is poignant, and I hope everybody, really gets something from this. And what I'm going to say to you is that, in every field of life, no matter what you do, somebody is going to make it so that if there's someone in that same particular field that will be able to listen in or look in on you, the person is going to look at it a little bit differently. So for example, and this is a bunch of doctors talking, let's just say, if I say, if my friend's son goes into the hospital and then I call the hospital as my friends, you know, I guess as the person that's in charge, right? If I call and talk to the doctor that's taking care of my friend's son, that doctor is going to do a little bit more because he knows that I'm watching, or she knows that I'm
Right.
watching. That's just
Correct.
human nature, okay? But what I
Correct.
think you always need to look at, especially when we're looking at people that are in this realm, implicit bias is probably what killed your son, okay? Implicit bias killed your son. And what I will say, there's no way for any of us to ever really know, because we have to really look through a lot of medical records for us to see exactly what it is. But if you're an African-American woman and you are delivering and you are having a baby in a hospital, the more education that you have, the more chance you're going to die on the table, just like in a underdeveloped country. Okay, if you're if you're a child and you're in a hospital and you are not being taken care of by a Black doctor and you're inpatient, the odds of you dying are 7 times higher. If you are a Black man and you have chest pain and you go into a hospital in Boston, and Harvard did this study 15 years ago, then the odds of you getting an EKG and an advanced cardio assessment is almost 0 compared to your white counterparts. So all these things make it so that, you know, inherently, you know, doctors and medical professionals think that Black people are less than. They think that our pain tolerance is more. You know, we didn't have a problem with opioids in America until we could get opioids on the street, because we would never
Absolutely.
prescribe opioids. We're dying
Correct.
from fentanyl overdoses now because it's cheaper and it's much easier to get than MS Contin or OxyContin. So the point is that what you've experienced is terrifying. But I will always tell you, and this may be something I shouldn't say, if you ever go in the hospital, anybody ever goes in the hospital, tell them that your uncle's a doctor and that your uncle will be calling later on to discuss what happened to the patient before something bad happens. Just say that,
Yes.
whether you got an uncle or not. Just say it.
Yes.
And
Yes,
Miss
absolutely.
Neville, I'm just gonna piggyback on Dr. Hebert, because, you know, I was thinking also too, like, just the inequities that exist and how do we change this? And Dr. Hebert is nailing it, that, you know, bias comes in so many ways, you know, in our healthcare system, in our education system, in all these systems that, you know, that we face in our daily lives. And we have to, in order for us to, you know, get physicians to provide equitable care, we have to have education and training on bias, on microaggressions, on racism in the healthcare, in the workplace. We've got to change our admissions policies in med schools so that we can recruit more doctors of color, more persons of color, so that we have similar faces that we know are fighting for us, you know, on that side. We have to update curriculum within our med school so that, you know, we have examples, you know, that we can use real examples of things in which there are inequities that exist in healthcare. We also have to get involved in research and clinical trials. You know,
Yes.
there's a host of things that, you know, while this is such a sad and unfortunate, you know, thing that happened to your family and to your son, you know, it clearly screams, you know, the inequitable care that, you know, we have to change. We have to transform our healthcare system. We have to transform our education system. We have to transform, you know, our legal system. There are so many things that just by sight of us, we are already, you know, stereotyped and stigmatized with, and we have to do something about that. So good
Correct.
for you for starting your organization.
Thank you very much.
Ms. Neville, thank you so much for sharing your story with us. We're moving toward the end of our time, so I want to try to give the panelists an opportunity to wrap up with some final concluding thoughts. Couple of quick questions. We are in the middle of a legislative session right now. We talked a lot about vaccines earlier. I know there are a bunch of bills out there that relate to vaccinations. Any bills out there that we're eyeing or that we should be keeping our eyes on in terms of some of the health issues that we've talked about?
I think at this time, there's not enough bills. I think that is part of what my movement is going to be, because we have a few bills on the table that I paid attention to, but they still don't quite hit the bullseye for me. I think with PATOS, I can get a little more specific as to what I would like to see happen, which is something in place in the medical facilities that makes it mandatory. And I think that's going to be a hard fight, because a lot of times I've been told by a lot of my friends that if your insurance does not allow it, it probably won't happen. So that's where we have to start, with changing some of the policies for the insurance, because a lot of the hospitals are trying to cut back. They don't really want to go as far as they need to go because maybe the insurance won't pay for it, or they're more concerned about the finances than they are about the patient.
Okay, and the question, I wanted Dr. Hebert and Dr. Anderson to weigh in on that if they could.
Yeah, we have a couple of vaccine mandate things out there. And just as full disclosure, I am 100% for a universal mask mandate and a universal vaccination mandate. I am. And people are like, oh, this is America. Oh, free land of the home of the brave, blah, blah. You're free and land and all that and brave and all that can't encroach on my safety. So there is one out there. It ain't going to pass because this is Louisiana, but we put it up there because we believe that it really should have. There's a lot of medical marijuana bills out there right now that some of them are going to pass. Definitely, we're going to expand the dispensaries from probably 9 to about 40. Because we now are able to sell the actual marijuana plant to folks for their medicinal purposes only. So it's a lot of stuff out there, a lot of stuff.
And I echo the mask and the vaccine as well, like I'm 100%. So yeah, I agree.
We have one question from someone who's identified as the Micah Project, Mike Hunter.
Yes.
The question was an autopsy performed and a cause of death found for Miss Neville's son? Is that the only question you have?
Yes, that was it. Thank you.
Okay, Miss Neville.
Hi, we actually set up the autopsy when the body was taken to Charbonnet, but they canceled the autopsy. They said something happened and the person the coroner could not make it to the funeral home, and therefore the funeral home said we had to move forward, because if they would have waited any longer, then they would have not been able to have Tristan to look the way he needed to look to be presentable for the funeral.
All that's untrue, just so you know. And if anything ever like this happens to anybody else, that is 100% untrue. And it doesn't matter. We could have had a closed casket at the funeral. That is untrue. You could get an independent autopsy, and any New Orleans could have done the autopsy. You might have had to pay for it, but it might have been $1,100.
Right, I did, yeah. I definitely offered to pay for the autopsy. That was never the issue. It was the coroner's office in Jefferson Parish who said that they could not make it. And then when they called me, they contacted my sister. It was about an hour before they were supposed to arrive. So that was the situation I was faced with. Thank you. That was a great question.
And I'm very, very sorry for your loss. Dr. Hebert said everything that needs to be said about this situation. Medicine has the same bias as everything else in the United States. There's nothing that takes place in the United States that race is not involved in. Nothing.
Absolutely. I agree. And I think one of the things that really helped me to feel a little more comfort was I just happened to be friends with a young lady, and her husband is a world-renowned brain surgeon. And so he was able to explain some things to me in a more in-depth way. And he agreed with me 100%. And I was very grateful, because sometimes we don't even have access to that information. And he just kind of enlightened me on some situations, and I was very, very happy. But I think what I noticed is at the end, and I called it the end because it was the day before my son, we had to take him off of the ventilator. Everybody started to try and call me with different explanations and different stories. Well, at this time, I just did not want to hear it. At this point, I still do not want to hear it. I am in a, I cannot disclose the information, but I am in a legal battle with the hospital as we speak. It has nothing. Yes.
On that note, we literally have 1 minute left, and I want to give our
Okay,
panelists an
okay.
opportunity. Thank you again for sharing your story. Doctors Hebert and Anderson, if you guys have any final parting thoughts that you want to share with the audience.
I'll just be real quick, and I just always say, trust the science, but make sure you ask the questions and make sure that you do your homework. But, masks, vaccines, all those things protect us, but it also protects each other. Be safe, be happy, be wise, and be kind.
Dr. Hebert.
Yes, I would just like to say that I want everybody out there just to remember that as marginalized populations exist, we all are marginalized at this point. If you have any type of pre-existing illness, if you have any color to your skin, if you're poor, if you're from Appalachia, if you're anything like that. So it's not just a Black thing. We need to band together, because right now this system is being pushed by things that are not science. And right now everybody should still be wearing a mask. And I have a trademark slogan: wash up, mask up, separate, and vaccinate. And until I tell you to stop, I keep doing it. I am.
Thank you
Agreed.
both. Thank you to Dr. Anderson and Dr. Hebert. Thank you, Ms. Neville, for sharing your moving story with the audience. And thank you all for joining us. And as everyone said, please be safe, and we hope to see you back here tomorrow for the next day of the policy conference. Thank you.
Thank you.
Thank you.
Thank
Thank
you.
everyone for having us.